Hello everyone, this is Dr. James Lee again. Welcome back to Medical Consultant video. So last time we talked about hypertension in general. We talked about how to diagnose hypertension, what's the means of hypertension, and so on and so forth. So today is the second series of a hypertension topic, and I will be speaking in terms of how to treat the hypertension, what are the complications, and my personal thoughts on hypertension in general, and we'll conclude the session. So what are the long-term complications of untreated or uncontrolled hypertension? And needless to say, these are the very important information that you must understand and make sure you take care of your high blood pressure to avoid and prevent these long-term complications. And the most common ones are obviously stroke. So the hypertension strikes the brain, and sometimes it can be hemorrhagic, which means that you bleed inside of your brain, or sometimes you call it embolic, which means that other factors like a high cholesterol, fragments of cholesterol flying out to brain vessels and block the brain vessels, and you end up getting a stroke. So that's one biggest the complications that you can see from uncontrolled hypertension. The other one is a hypertensive heart disease in general that includes irregular heartbeat like atrial fibrillation, ventricular tachycardia, and so on and so forth. And also the blockage of arteries of the heart, which can lead to a heart attack. Also, not to forget about kidneys, because hypertension on a persistent basis damages the kidney tubules and cells and end up leading to chronic kidney disease. And some of very unfortunate patients can lead to end-stage renal disease, and they need a dialysis. And eye complications are very common too, and we see retinal hemorrhage, sudden loss of visions, and overall your vision quality really decrease and decline, and some patients end up being legally blind. So these are the major four organs that hypertension strikes, and obviously in addition to these complications, there are more things that hypertension can lead to, which I'm going to omit at this point because it's such a long list. But as you can see, what I'm trying to say to you is these are the very core factors that, and information that you need to understand why the hypertension needs to be treated. So when you visit your doctor for follow-up care, and probably your provider is going to be offering you some of test or workup, making sure your condition is well under control. And for instance, for my case, over the last 30 years, whenever I take care of hypertension patients, at least I run 1 EKG per year, making sure the patient is in good rhythm. He has no bad patterns of the rhythm itself, and also any bad patterns of early coronary disease that it may lead to heart attack. So that's very critical part of your examination for the maintenance. And also you can do some medication review, making sure that your medications are effective and that you're not really developing any kind of unwanted side effects. And also some blood work is obviously help, and usually we run basic panels such as a kidney function with the mineral counts, make sure your potassium is okay, and your cholesterol profile, which is fasting, and the liver function and thyroid functions for supportive lab too. So having say that, it is important to visit your doctor at least every 6 months a year, making sure that you guys sit down with your provider and basically review the entire situation and how therapy is going, and that should really help you out in the long run. So next is the treatment section, which is very important and critical, because this is where your blood pressure actually being managed and keep you safe from having complication. So it all depends on your blood pressure level, and let's say for instance your blood pressure is in stage 1, and you really don't have much of a comorbid condition, then obviously you can stay on a conservative management that includes a weight reduction, low sodium diet, regular exercise, and so on and so forth. So without taking any medication and doing these things on a consistent basis, it can lower blood pressure. However, it does take tremendous effort from patient standpoint that it's much harder than it says, because it's a really it takes the commitment, and you really need to come up with a time frame that you have to do these things on a very regular basis. Now, when you say exercising, then everybody asks me, hey doctor, what do you mean by exercise? How much and how? Okay, very good question. So number one, I think the rule of thumb here is that you have to get your heart rate up to your age point, which means that this is the easiest way of figuring out what your heart rate should be when you actually do cardiovascular exercise. So take number 220 minus your age. So for instance, if I do my own heart rate calculation, then 220 minus 60 equals what? 160. So that should be my maximum goal of getting up my heart rate. So that's very adequate. That's probably easiest way to find out what I need to really do in terms of heart rate and your exercise rigorous level. And they should be probably between 30 minutes to about an hour. And at the end of your cardiovascular exercise, you should be sweating. So we're not talking about just passive walking here, but we're talking about active walking or treadmill, swimming, things like that. You should be sweating at the end of your cardiovascular exercise. Not to forget the isometry exercise, which is the muscle exercise. Weightlifting really helps, especially lower extremity muscle management and training. Not to forget that part too. So it should be anywhere between 60% to 70% cardiovascular, and the rest of them muscle exercise and weight training. And make sure you stretch your muscles very well at the end. And then another common questions that I get is, should I do my cardio first or weight first? The recommendation is do the weight first. And then after that, you finish off your exercise by doing cardiovascular. So that's probably better sequence of doing an exercise. And at the end, you just stretch your muscle well. And then you take water or a little bit of protein at the end. That also helps too. So next is the medications. So let's say you've done a lot of good job exercising, reducing your weight, watching your diet. So let's say you have done that. However, unfortunately, your blood pressure is still persisting, it's not coming down. So obviously, you're entering the phase of likely needing of medication trial and try to lower your blood pressure. So I'm not going to mention every medication out there because there's so many out there. So for the purpose of our discussion, I will highlight with the very common drugs that a lot of doctors use, and you can possibly see your bottle, which one you're on, and try to learn from our talk today. So number one, very commonly we use a water pill, known as a diuretic. And the most common form of diuretic that we prescribe is hydrochlorothiazide, or sometimes what we call Lasix, furosemide. And these drugs are actually the water pills that it flushes the potassium and sodium out so that it lowers the blood pressure. However, sometimes they do too much, which means that your sodium level, your potassium level may be a little too low because of the therapy. So make sure you do a periodic blood work, making sure that your blood potassium and sodium levels are adequate and steady, and prevent falling of those minerals, and those are very important minerals. And also, if you have underlying gout because of a uric acid problem, you should not be on hydrochlorothiazide, because the hydrochlorothiazide do have a tendency to elevate the uric acid in our body. So if you're a gout patient, probably taking hydrochlorothiazide is not a good idea. Number two, commonly we use a class of drug called beta blockers. For example, metoprolol, atenolol, propranolol. So these are basically beta blockade, and it lowers the blood pressure, and it lowers the heart rate, and it dilates the vessel. So that's the sort of a mechanism that these drugs are in your system to lower the blood pressure. So it's a great drug, again, well tolerated. However, the most common side effects that you may experience out of this beta blocker is that generalized fatigue and tiredness. And in male, erection problem, you may have erectile dysfunction because of a beta blocker, or sometimes way too low of a heart rate, which is known as a bradycardia, and sometimes you can become dizzy and lightheadedness. And these are the very common side effects that we hear. So if you're taking beta blocker and you're experiencing one of these complications or side effects, you should consult with your provider and consider changing medication depending on your severity. Number 3 class is known as ACE inhibitors or ARBs. These drugs are very commonly prescribed to lower your blood pressure. And these medications do work on your kidneys, and basically it lowers the kidney hormone, which pushes the pressure up. So that's the sort of main mechanism how things work with these medications. However, it does have a side effect, and most commonly dry cough. So which means that after starting medication, a few days later or a few months later, you can start developing unexplained dry cough, and sometimes that can be due to ACE inhibitors. Common drugs that we prescribe in general is known as lisinopril, benazepril, zestril. These are all ACE inhibitors. So if you're taking medication and you start having a dry coughness, and for some reason it's keep going, then most likely it is due to the side effects of lisinopril or ACE inhibitor in general. Another common conditions that we see, which is a little more rare than the cough, is the what we call angioedema. That's a swelling of your lips, swelling of your tongues after taking ACE inhibitors. It usually happens in a black ethnic background, and sometimes it can block the respiratory tract, so it can be potentially dangerous. And if you do developing any swelling of the lips and tongue after taking ACE inhibitors, then you probably need to stop that medication right away and speak with your provider so that the provider can take care of you. In terms of cough, more Asian people are more prone to get a dry cough. So if you are an Asian person or Asian background and taking lisinopril and having cough, then most likely the lisinopril or ACE inhibitor induced type of a side effect. So you should also consult back to your provider so that the provider can change your medication. In addition to ACE inhibitors, there are ARBs, usually losartan, valsartan. So anything that finishes with the sartan, those are ARBs. It's a very similar drug to ACE inhibitors, but the lesser degree of side effect. And both medications, though, periodically you do need a blood work because it has tendency to increase your potassium in your blood. So if your potassium exceeds more than 6 in your blood, then it can actually affect your heart rhythm. And if you go 6.5, your heart rhythm can stop. So there is such a thing as a drug-induced cardio complications such as cardiac arrest because of a rhythm problem. So make sure you do your blood work every 6 months or 2 years and confirm that your potassium level in your blood is safe. The fourth common class that the doctors prescribe in general is called calcium channel blockers. Calcium channel blockers, a good example, amlodipine, nifedipine. These are very good drugs because what it does is it blocks the calcium channel in your blood vessel so that the blood vessel don't contract, so it dilates. By dilating, which means making your diameter bigger, pressure obviously fall. That's the mechanism. However, the side effect of this medication is in fact swelling of your lower extremities because the vessel dilates too much, and sometimes the contents in your blood vessels can leak out to your soft tissue, end up getting a retention of fluid, especially the lower compartment of your leg. So if you're taking calcium channel blocker like amlodipine and for some reason you get very puffiness of your lower extremities, and your legs feel very heavy, and then start changing color, like a reddish color, then most likely you're developing some sort of side effect from the calcium channel blockers. If you stop the calcium channel blockers, these are reversible. It goes back, but it may take a little time. Some doctors put them on a very short course of Lasix, which is a water pill, to pump out the extra retained fluid out of your tissue. The higher the dose, it happens more. So it comes with like a 2.5 milligram or 5 milligram, much less, but when you get it up to 10 milligram of highest dosage of such as amlodipine, you definitely will get some sort of puffiness in your lower extremities. So if you start developing that, also I strongly advise you to see a provider, and we discuss about your medication regimen. And then lastly, other additional drugs that we don't commonly prescribe, but certainly we do use. One class of it is alpha blocker, and typically like a clonidine. This is the type of drug that I use in a very rescue situation. So for example, I'm seeing a patient in my office, and his pressure for some reason is like 200 or 120, very high. Then that's the situation that I may prescribe clonidine for one time or a couple times to lower the pressure, to avoid the hypertensive crisis while adjusting his normal blood pressure medication regimen. Another drug that commonly sometimes added is hydralazine. Obviously same mechanism, it dilates the vessel, but has a lesser than amlodipine like calcium channel blockers do, lesser degree of the swelling. And so these are the drugs that we can think about in case you need it. But definitely I strongly recommend you sitting down with your provider and rediscussing and revisit the issue, and then make sure you're in a safe drug and very effective regimen. So in addendum to all the things that I discussed with you, there are a couple more recommendations that I would like to leave with this video clip. Number one is that the hypertension and type 2 diabetes and high cholesterol, these are all conditions that are known as metabolic syndrome. So if you have a hypertension, there are always chance that you may be diabetic, and if you have a hypertension and diabetes, you may have a high cholesterol. So we combine together, we call metabolic syndrome. So therefore, my personal recommendation to you is make sure you do eye examination once a year. Make sure that the back of your eyes, retina, is not changing because of your high blood pressure or diabetes or what have you. So that's one recommendation that I strongly recommend. Number two, to follow up on a regular basis with the provider. Every 6 months to 1 year is adequate. And please give your provider a chance to examine you and adjust your regimen and make sure your medications are working. And finally, if you have any kind of side effect you're experiencing from the medication, you immediately report to your provider so that you don't have to live with the side effect. And there are many other drugs that are out there that we can readjust. So those are the important facts that you need to know as a patient. So in conclusion, hypertension is a very treatable condition. So it takes a little effort from you, and make sure you do lifestyle change, including proper dietary control, low sodium diet, regular exercise. And if you do need to take a medication, please do so. However, please do so under supervision of your provider. And please give a chance for your provider to see you and examine you and continue to update your medication regimen and making sure that you're not experiencing any side effects. If you do have some side effect you think, then please don't wait. Immediately contact your provider, revisit the issue. And again, the medication regimens are many, so it can be altered and changed in favor of you. The bottom line here is to prevent you from having stroke and the other heart disease and the kidney disease and what have you. So therefore, it's really the cooperative management between you and your provider. So thank you so much for watching this video, and next time I will come back with a different subject, and I hope you enjoyed the video today and learned. Thank you so much. This is Dr. Lee. Until next time, so long.